here is your stem. Okay, so if you've read and understood, considering it clinical examination station, please begin.
Hi, my name is Dr. Muhammad Ali. I'm one of the exam candidates. Today, I've been asked to examine both of your lower limbs. I hope you're okay with it.
Lower limbs or your legs? Okay,
Your
yes,
legs.
yes, that's fine with me.
Okay, this examination would include looking and feeling and moving some of your joints of your legs. Okay.
Yes, yes,
Can you can you please stand up
yes, okay,
and take your gown off?
okay.
And could you please take a walk towards that wall?
No, doctor, I can't. What if I fell?
I'll be moving with you and I'll spread my arms around you.
Yeah, and I won't let you fall by any means. Okay, now I'm walking.
Okay, can you walk on your heel?
Okay, again
Can
reassure.
you know?
I'm around.
Yeah,
I won't let you
I'm
fall.
around and I
Yes,
won't let you fall.
yes, doing, continue.
Can you please now walk on your toes?
Okay, done.
Okay, now I would like to examine you from the front.
Okay, what should I do, doctor?
And
Should I stand?
just stand right there. I would just take a closer look on your legs.
Okay,
And now can you move to the right and I will look from the sides.
okay,
Now can you turn around and I would like to have a closer look from behind.
okay,
Okay, now can you please lie down on the couch.
okay.
Now I would like to feel with my hands to check for temperature, any tenderness.
Okay,
Now I'm checking with the dorsum of my hand, the uh, hip, thigh, leg, and foot with my dorsum of my hands, the temperature, and also I feel the tenderness. Then I will look for the peripheral pulses, palpate for the peripheral pulses. I will check for the femoral, popliteal, and posterior tibial.
okay,
Then I would perform the ankle brachial test to see any difference. And then I will move to the neurological examination. I will check the tone of both the lower limbs by leg lifting and leg rolling.
okay,
Then I will check the power of hip extension by placing my hand under the knee and asking the patient to not let me uh, pull it off the bed. And
please
then I will
explain
check.
which leg are you examining first?
I will to compare. I will do the both if I'm checking the power.
Okay,
Then I will put the hand on the knee and ask the patient to uh, to let both his legs off the bed and don't let me push it down to
okay,
check for the hip flexion. Then I
yes,
will put both my hands behind the leg and ask the patient if he can and ask the patient to not let me straighten both his legs to check for the knee flexion. Then
Okay.
I will put both my hands on the leg and ask the patient to extend his knees, straighten his knees, and against the resistance of my hand. Then I will put both my hands on the dorsum of the foot and ask him to point towards his head against the resistance of my hand to check for the dorsiflexion of the foot. Then I'll check the dorsiflexion of big toe, and uh, after that I'll check the coordination. I'll ask the patient to put heel of his right foot on his left knee and roll heel uh, over the shin of the left leg and do it repetitively. And I'll ask him to put the do the same with his left leg. Put the left foot heel on the knee and roll it over the shin of the left leg to check for the coordination. Then I will do the sensory examination. I will check the light touch sensation on different dermatomes like L4, L5, S1, L1, 2, 3. And then I will use the neurotape to check for the pain sensation. And then I will check the reflexes of knee and ankle. And after that, I'll check the plantars. And I will also perform a few tests like straight leg raise test, and also will perform the femoral nerve sheet test, stretch test.
Okay. Can you please summarize your examination results?
I've today I've examined this gentleman who presented with intermittent claudication. I noticed that patient could not have normal gait, and on ankle brachial index it is 4. On checking the ankle brachial index, it is 4, and the temperature on both the legs is less. It is both the legs are cold as compared to the other parts.
So,
And
yes, at the completion of your examination, your results are consistent with which provisional and differential diagnosis?
peripheral arterial stenosis or peripheral arterial disease, because
And
patient is smoker and diabetic and hypertensive,
yes, any
and
other?
and because the limb temperature is cold, and both the legs are shiny, and peripheral pulses are also not as good as they should have been.
How would you confirm your diagnosis?
I will do the Doppler ultrasound
And
uh, and CT angiogram.
okay, if it's not feasible, then
Then I can only go with the ultrasound, Doppler.
okay. Any other investigations you'll go for? Blood glucose level, lipid
Yes, I would
profile?
go. I would go for blood glucose. I will go for the lipid profile,
Yes.
uh, CBCs, and
Please
PTINR.
tell me what treatment can you offer this gentleman?
As this seems to be chronic limb ischemia, I can put the patient on anticoagulants, uh, and I can also give lipid-lowering medication like statins. And for the good control of diabetes, I can prescribe some hypoglycemic drugs,
Okay, and
and I can put
if
patient on
your
anticoagulants.
yes, if your conservative medication or management fails, what else can you offer this gentleman?
If my conservative treatment fails, then I can go for surgery if it is feasible, like stunting or
Okay.
bypass graft.
Instead of saying surgery, you could say invasive management.
Yes, invasive management like stunting or bypass
Yes.
graft.
Yes, endovascular and okay, thank you.
Okay, thank you.